In the name of God, most gracious, most merciful, we would like to welcome the speakers to this press conference of the National Task Force for Combating Coronavirus, COVID-19. His Excellency Dr. Walid Al-Mana, Undersecretary of the Ministry of Health, Lieutenant Colonel Dr. Manaf Al-Qahtani, Infectious Disease Consultant at the BDF Hospital, and Dr. Jamil Salman, Infectious and Internal Disease Consultant at Salmania Medical Complex. And we would like to know that this press conference is going live on TV and on the YouTube channel of the Ministry of Health in 5 different languages. And we also have the journalists and reporters joining us remotely. Now we begin with Dr. Walid Al-Mana, Undersecretary of the Ministry of Health. In the name of God, most gracious, most merciful, praise be to the Lord who has held everything within his knowledge. Praise be to him for his countless blessings and grace. Praise be to the Prophet. I'd like to welcome you again to this press conference through which we aim at informing you on the most recent updates regarding dealing with COVID-19 in the Kingdom of Bahrain. At the beginning, we emphasize that we should not be reckless in implementing the measures issued by the relevant authorities in order to mitigate the spread of this virus and maintain the level of dealing with this virus. And because of the negligence and the irresponsibility, we are still witnessing an increase in the number of the active cases in January. So we affirm that we are all responsible for the increase or decrease of the active cases, and any increase could take us back to previous level of dealing with COVID-19. And we note that all the decisions taken in dealing with the virus are reviewed on a periodic way and update them accordingly for the interest of the citizens and residents. So there is an increase in the active cases from the 1st to the 18th to 43% compared to the previous percentage. 18% of these active cases are for children who are 1 year to 17 years. So this increase requires from everyone to double their efforts and continue with caution during this period and not to be reckless because we're going to see the results. On the other hand, we note that the Ministry of Health continues to conduct inspection extensively in cooperation with the relevant authorities for restaurants, salons, whether for male or female, and the sport clubs in order to check if they are implementing the medical precautionary measures. And we reiterate that all the actions will be taken, whether administrative or legal, against the violating individuals or institutions. And we call upon all the institutions to implement these regulations. And upon the directives of the steering committee led by His Royal Highness, the Crown Prince, Deputy Supreme Commander, the Prime Minister, the mobile vaccine units are launched, and they are for the elderly people who cannot move. So, in order to maintain their health, so whoever who are elderly and they have chronic diseases, they can register for this service through Health Alert or call the hotline 444 and also register via Be Aware app. And rest assure everyone that those who are interested and who have registered for the vaccine, it is going to be available for everyone. So you do not need to worry because we have received some inquiries and some complaints like the vaccine was not available. But rest assure everyone that the vaccine is going to be available soon for everyone. The kingdom ensures that the vaccine was available, and it was among the top countries who initially took the initiative to register for this vaccine, and the available vaccines are going to be distributed according to the schedules. So we call upon everyone to follow and implement all the precautionary measures and to be hand in hand to combat this virus. We remind you to limit the gatherings to the small gatherings of the same small family and the open space instead of the closed areas. Now, let's review the capacity for isolation and treatment centers. As for the capacity for the isolation and treatment, 5,202 beds, of uh, which out of the 2%, so 2,243 are occupied. As for the active cases implementing the optional self-isolation are 2,205 because they don't experience any symptoms. As for the recovered out is 96%. As for the death percentage is 0.737%. To conclude, let's take into consideration the national efforts, which are large and ongoing, conducted by the authorities concerned to combat this virus, and we shall collaborate to achieve our target by eradicating this pandemic. Now, I'll leave the floor to my colleague, Dr. Manaf Al-Qahtani, infectious disease consultant at the BDF Hospital. Please proceed. Thank you very much, Dr. Walid Al-Mana. In the name of God, O my Lord, relieve my mind and ease my task. Now, today we're going to talk about the importance of vaccination, and we talked about it many times. Vaccines are going to be one of the means to eradicate this virus, not only in the Kingdom of Bahrain, but around the world. The vaccine is a substance that creates antibodies that prevent the virus or the complications of this virus. We talked many times, and recently there is some misinformation about like preferring the having the virus rather than the vaccine because it will create like a sort of unnatural antibodies. And we mentioned like the complications are of the virus are much bigger than the ones of the vaccine, because even the recovered of the virus we mentioned should take the vaccine. So let's differentiate between this misinformation, to have the complications rather than the vaccine. And we also mentioned many times that the vaccine is an optional decision, but it has to be a responsible decision. And the Kingdom of Bahrain has launched the national campaign for vaccination to take the vaccination against COVID-19, and it was a well-studied plan, and it showed the safety and efficiency of the vaccine, and the campaign is ongoing. The vaccines are available you need to reschedule for an appointment until we receive the next shipment. It's important to note that the vaccines are not going to be quick and like day and night. It's going to be in different levels, take into account the manufacturing, production, distribution of this vaccine. That's why the Kingdom of Bahrain has set a plan to receive the vaccines appropriately. And due to the awareness and on the importance of this vaccine, thank God, the Kingdom of Bahrain is at the third level of the vaccines, and it has reached 8.4%, which is a great achievement and of pride for everyone, and it proves that the national efforts are ongoing. So far, there are 143,596 people who received the vaccines in the Kingdom of Bahrain, and this is a huge number. And that's why, thank God, Bahrain has achieved the third level globally. We thank everyone who contributed to this and participated in taking the vaccines to maintain the health and safety of the community. And as mentioned by Dr. Walid, we have rescheduled the receipt of Pfizer shipments, which were expected to be received in January. And that's why we mentioned there is a mechanism and technical factors, and we have rescheduled the shipment of the Pfizer vaccine, has which were supposed to be delivered earlier in January, but there is a mechanism and technical that oblige us to reschedule the shipment. The Kingdom of Bahrain, as mentioned, is among the top countries which requested the vaccine from the company in line with the plans. And I would like to note that to remind everyone to take the second dose of the vaccine in order to activate the antibodies. And this, there was some misinformation like the one dose was enough. No, it is not enough. You need to take the second dose in order to take a long-term antibodies. That's why we request everyone to follow all the guidelines and to have the right trusted source, which is the Ministry of Health. And we remind you, everyone, that the vaccine is optional, but it is really and necessary to maintain the health and safety of everyone. And everyone taking the vaccine should still implement the precautionary measures because the pandemic is still there. It doesn't mean like when you take the vaccine that this is enough. You have everyone to implement the guidelines in order to limit the spread of the virus in the community. And we call upon every individual to follow these guidelines issued, including wearing face masks and taking the social distancing. And before concluding, I would like to note that the that the limit of the number is a responsibility, a national responsibility upon all citizens and residents. So please let's follow that. And to conclude, I really feel proud uh, for the determination of this country to combat this enemy, which have exhausted the whole world. So my great gratitude for the National Task Force with all their members and also the Bahraini community for their solidarity that made Bahrain an example. And now I'll leave the floor to my colleague, Dr. Jamila Salman, Infectious and Internal Disease at Salmania Medical Complex. Thank you very much, Dr. Manaf Al Qahtani. In the name of God, most gracious, most merciful, peace be upon you. We would like to welcome you to this press conference, and we continue by reiterating that we shall all follow the guidelines issued by the Ministry of Health and the Medical Task Force, and that both the ministry and the task force are the ones responsible, and they are doing all their efforts in order to limit the virus for the safety and health of citizens and residents. The ministry continues to conduct the random tests in all the areas in the Kingdom of Bahrain, especially the most populated ones. The random tests are arranged by specialized team, technical and medical staff in order to maintain the health and safety. And we note there are three important points. Number one, to not that the contacts should not go to the random units and wait for the call from the concerned team of the tracking team. And number two, you should follow all the guidelines and issued by the responsible team. Number three, which is really important, the necessary to disclose all the information in order to track all the contacts in order to reach them at an early stage and limit them and provide the necessary treatment. So please, everyone, follow and continue with caution and implement the precautionary measures and guidelines, and confirm that we shall all stay away from the gatherings regardless of their types and just limit them to the small family gatherings and the limited and regular social gatherings. And even within the same small family, we should implement the guidelines if we have among us those with underlying problems. And while going outside, we shall all implement them anywhere, anytime. And let's be aware the virus is there. Let's continue with caution in order to combat it. Now, let's review the status of the active cases. We have 16 critical cases, and those receiving treatment, 38 active cases, while 2,945 are stable out of 2,961. As for the recovered are 94,937, and this is a great number because of implementing protocols. To conclude, everyone, please follow the guidelines and implement them in order to combat the virus and go back to our normal life. Thank you very much. Thank you, ladies and gentlemen, the speakers. And now let's have the questions from the journalists and reporters who are joining us remotely. Question from Fatima Ali from Akhbar Al Khalij newspaper to Dr. Walid Al Mana. The Ministry of Health announced yesterday that 24 people were infected because of negligence in one of the clubs. So, will the National Task Force going to reconsider the closing of certain activities? Thank you for the question. Well, the National Task Force is tracking on a daily basis, as we mentioned before, that these standards are related to compliance and tracing of the active cases, the capacities. So these items and standards are discussed, reviewed, and is there a chance for closing or reopening? Yes, everything is possible. And recently we found that there are certain strict regulation decisions, because, for example, for conducting parties, weddings, and we noticed that in addition to having the activities, if people are implementing the guidelines, it is very important. For example, people are gathering, but they don't wear the face masks, they don't take the social distancing, they don't wash their hands. So, such things would lead to the increase of the active cases, and people sometimes are being reckless about it. So, assessing the situation, yes, it is on a daily basis and could lead to closing or reopening of certain activities. But the responsibility is upon the citizens and residents. So if we have like a year since, for combating this virus, and we are certain now that the responsibility is individual for people. You implement the guidelines, you wear the face masks, have the social distancing, wash your hands, avoid unnecessary gatherings. This is really important for us to go back to our normal life. Question from Amir Al Hassan, أخبار العرب newspaper to Dr. Manaf. There are certain studies and research to the risk of the vaccine on the elderly and the chronic disease people. What are the complications for the vaccines? And how can you monitor the side effects? Now you have four questions. First, we missed the brothers and sisters, the journalists. Usually we have them face to face, remotely. Hopefully, we pray God that we will have them face to face, present. Thank you, Ms. Amira, for the question. Let me rephrase the question that you said there are studies about showing the risk of the vaccine of coronavirus. I don't think there are studies that show the risks, that there are questions because there is no risk or danger of the corona vaccine. In fact, those with the chronic diseases are among those that have the priority to take the vaccine. And it was one of the reasons the Kingdom of Bahrain tried the clinical trials in order to see and answer these questions. These are not dangers. So there are no dangers and there is no risk. All the chronic diseases, they have their own types, their own features, and sometimes they are stable if they consult the doctors, so they have the priority to take the vaccine. The second part of the question, the health guarantees implemented by the Kingdom of Bahrain when we started uh, the the vaccine, the Pfizer vaccine, we started in King Hamad Hospital to confirm the safety and efficiency of this virus because it was outside the Kingdom of Bahrain, and so we had to follow up with those took the vaccine for like 15 minutes and 30 minutes for those who have allergies to certain medicines. And this confirms the commitment of the Kingdom of Bahrain to implement all the health regulations that ensure the efficiency of this vaccine. As for the fourth, the side effects. Well, I already mentioned that the side effects are followed up during this period, whether 15 minutes or 30 minutes. And thank God we have over 100,000, and some of them are with chronic diseases, and some of them were elderly, and they did not have any side effects. And that's thanks to the God that the vaccine is really among the effective tools to combat this virus. The question to Dr. Jamila Salman from GDN. If by any chance one had received the first dose and he got the infection before the second dose, what is the protocol for that? Thank you for the question. Let me clarify an important point for this. To take the doses at their right times. For example, the first dose, they start to create the antibodies, which like small amount, and then the second dose in order to increase the number of the antibodies. And like over 35 days, they will have the sufficient antibodies within their body. The amount of the antibodies for any person would differ from one person to another depending on their immunity. So, for example, if they took the first dose and they got the second infection, so it is important because they might not have to take the second dose. If they by any chance got the virus, they continue according to the schedule and take the dose at the right time, because being infected does not stop you from taking the dose or the second dose. You should even take it after the recovery of the virus. So the important thing here is to take the doses at their scheduled times. So, and by taking the doses or the vaccine does not mean you should stop wearing the face mask or not washing your hands. We have to cover the whole or the majority of the community. Question from Tamam Busafi to two questions to Dr. Walid. With the finish of the vaccine, when do you expect to receive the second shipment, the second part? Don't you think that the positive speech led to the negligence and therefore led to the increase in the active cases? As for the availability of the vaccine, it is it is continuous. We have rescheduled the shipment. So if you say it has finished, it is a bit a big word. So let's say it is available, though with limited number, and we can go back, as mentioned by Dr. Manaf. There are some logistic things, administrative, some issues with the manufacturer. All these would lead to delay of the availability of the vaccine. So when we say reschedule, it means the shipments are going to continue to be available. So when it is going to be soon, and we have rescheduled it, so there is no problem. As for the is the vaccination was, we don't want people to have this idea, because every press conference we confirm that in addition to the vaccine, which is really positive, but in addition to that, implementing the precautionary measures is important, and we should not be reckless about it. So, in addition to the vaccine, people took the first dose, the second dose, which they need maybe 2 weeks to create the antibodies, and we still need in the Kingdom of Bahrain to have more people to take the vaccine, to have a large number of herd immunity. So it's really important to implement the precautionary measures, and really important not to be reckless. So if they got a message that the vaccine is going to have a chance to be reckless and to, be neglecting, this is a wrong message. And we repeat over and over in the press conferences, wearing face masks, social distancing, washing hands, all of these are important, and to avoid the unnecessary gatherings. So yes. Also, question to from Sandeep to Gulf Weekly. Some of the GCC countries announced the new type, a mutated type of the coronavirus. Has Bahrain discovered any related cases or suspected cases or confirmed cases of the mutated type of the virus? Thank you for the question. I think it's always raised with the new mutated type. Well, we continue to trace this type from the beginning, and we shall continue. It's going to be ongoing. So, have we found or discovered? No, we have not. But just to confirm to people, Having a new mutated type, will the precautionary measures change? No. We should implement them. And will the tracing mechanism or the tests or the treatment change? No. They are the same. They all the same. And we have the capacity for conducting tests for treatment, and also the good news that the vaccines that they cover the new types of the virus. So to exaggerate about this mutation or this type, as we are experts, we concerned and we track that and we're going to protect you. So the reasons for protecting people, the causes are there. So in terms of so this new type are traced ongoing. We don't have any yet, but the implementations against the the tests and the treatments are going to be available. So we conclude the questions and answers section. Thank you very much, the speakers, for your briefs and for answering the questions. Our thanks also go to the journalists and to you, all ladies and gentlemen. Before concluding, kindly be reminded to continue following all the precautionary measures and guidelines to mitigate the spread of COVID-19 and combat it. Thank you all.